Let's reloop a little bit back to chronic Lyme. Obviously, it's something that doesn't really exist that much within Western medicine, within the healthcare system. So, with that being said, why hasn't it been looked at more heavily? And until I feel like now it's starting to get more attention now more than ever. But why, after all these years, decades, people that have unfortunately passed away because they've had a lot of these different diseases or issues, but they were told it's cancer. They were told it's some other autoimmune issue or whatever might be going on. So why now? Why hasn't it been looked at more in depth? Were people just lazy? Is it more of just to gather more profits? Why is that?
I mean, I'm I don't know the exact reason. There's a lot of I think the majority of the reasoning is that it was what it was. It was classified as a tick-borne illness that only lived on the East Coast for a very, very long time. So, if for like someone like me, I lived in California, Lyme disease on paper did not exist there. Did it exist there? 100% yes. So you go back to they teach it, and doctors were like, okay, well, you can have Lyme disease in this very small portion of the country on the East Coast. That's it. So if you fell outside of that, you could not have it. That was the standard for a long time. And then it really just didn't have funding. I mean, when you look at the Lyme disease funding for research and for treatment, it was laughable when you look at it in comparison to some of the other things. But so there's no research. The funding is very, very poor. And really, I think one of the best things that happened was celebrities started coming out and getting it. And so you started having these celebrities, Shania Twain, and was it Ben Stiller, I think, and like you had these big celebrities, Avril Lavigne, coming out saying, hey, I had Lyme disease. And so it started to bring attention to it. And then you started to see more and more people kind of coming out. You got a lot more private donations. There's some amazing foundations like the Lyme Foundation that all takes private donation and they fund research. So you just started getting, I think, momentum behind it. But I mean, we asked about Lyme disease back when I was sick because our dog had Lyme. The vet caught it almost immediately. So we said, hey, the dog had Lyme disease. Is it possible she does as well? Nope, not a chance. You can't have Lyme disease in California. We were met with that time and time again. So it's just starting to change. I mean, moving the needle in medicine is slow because you have to get research on board, you got to get the big schools on board, and then you got to start teaching it. And so to get people to change their mind about something that they were taught is hard. The needle doesn't move quickly in any form of research or medicine.